Okay, how to estimate mortality and violence in areas of conflict. As Javid explained, it's essential to evaluate the severity of the situation, know what interventions to put in place, and do advocacy and témoignage. But we're faced with many challenges, so we have a trade-off between being quick and being accurate, and it depends highly on the context. I'll show you an overview of the main methods used, their benefits, their limitations, as well as new approaches that we're exploring. They rest on surveys carried out in 2025 on the conflict in Sudan. And the surveys on the conflict in Sudan shed very important results that we really wanted to share with you.
L'objectif. Slide de retard. Yeah. Alors pour chaque méthode, sera analysée
Okay, so for each method, we have a common analysis framework taking into account the complexity and the necessary resources, the required authorizations, how quick we get the results, and the reliability of the data. Also, we will evaluate to what extent the population surveys is a relevant proxy for the population really exposed to violence and mortality. First category of methods, simple and quick, to get a good indication of the scope, magnitude of mortality. You have this press release, 24th April 2002 in Angola. When we arrived in Bunche, we counted 14 deaths a day out of a population of 14,000. That's Thierry Darfort du Verger, responsible of the emergency operation. Many freshly dug tombs.
Pour l'anecdote, quelques mois après, il y a eu une enquête.
And a survey was done by Vincent in the same camp of displaced people, by the way. But this was a first quick estimation when we got there. And there are several approaches, counting the number of fresh tombs.
Ces méthodes sont rapides à mettre en œuvre.
Those methods are easy to implement. They don't need many resources. With remote technical support, they don't always require formal authorizations, but you need local agreements and minimal security reasons. He talks awfully fast. Representativity is limited, and the reliability on the reported cause of death is lower. Even if they're well designed, to meet immediate operational needs may have high value and unexpected external impact. It was the case in Bunche, in Banki in 2018. A survey was done with the mayors during a mass vaccination campaign, or in Zamzam, a large Darfur camp, where a simplified survey was carried out in 2024. Second type of method, surveys with the displaced population. It's a common approach resting on proven methods, and they generate good quality survey, but they require authorizations, and it takes a while to implement them. And there can be a bias because of the long recall periods, and because we can only interview the households who are in a given zone.
Donc, on va parler méthode, mais on va aussi parler résultats sur cette partie.
So, we'll talk about methods, we'll talk about results as well. As you know, the conflict in Sudan has been going on since April 2023. It led to massive displacement to the neighboring countries. A state of famine was confirmed in 2023 in Darfur, and mass atrocities were committed, notably in El Jenina. And then Zamzam camp was attacked, and there was the fall of the city of Al Fasher. Between those two events, Zamzam and Al Fasher, we conducted two surveys that allowed us to document the situation of the people who fled Zamzam, and about the events they experienced in Zamzam camp and when they were on the road, on the move.
La population de Zamzam a fui vers
Zamzam population fled towards several destinations, mainly Tawila, and for some of them Chad, which is 400 kilometers away. Retrospective studies, surveys were done in Tawila in June 25 on a site with 550,000 IDPs. where
Et au Tchad, dans
MSF-OCP was working, and in Chad, in your
réfugiés.
Kasuni
Et où
camp
MSF est
with
aussi présent.
80,000
Et les deux enquêtes utilisent une
IDPs.
période de rappel de
MSF
décembre
is present there.
2024 afin de
Recall
documenter
period April 2024, so as to
pendant et après la
document the
fuite de
time
Zamzam.
before, during, and after the fleeing from Zamzam.
Elle visait à estimer la
It
mortalité
aimed at
victime
estimating
d'obésité et contre juvénile, les causes de décès et
crude
l'exposition à la
retrospective
violence. Un
mortality,
échantillonnage
reported cause of
spatial a été
death, and
appliqué,
violent
basé sur les toits du camp à Taouila
events.
et sur des grappes tirées aléatoirement à Ourkassouni. Au total, 777
In
ménages
total,
ont été enquêtés à Taouila et 1000 ménages
777
répartis en 128
households
grappes
were
à Ourkassouni.
interviewed in
Près de
Tawila,
60% des déplacés de
and more in
Taouila étaient arrivés depuis le
Ultausuni.
mois d'avril, depuis
60% of the
l'attaque de Zamzam.
IDPs in
Et l'enquête
Tawila
menée à
arrived since
Ourkassouni a
April,
porté
since
sur les
Zamzam
personnes
was
arrivées début
attacked.
avril, qui représentaient environ
And we
80
surveyed
000
the people
individus.
who arrived since April, that is about 80,000
À
individuals.
Taouila, le taux de mortalité chez les hommes était
In Tawila,
significativement plus
mortality
élevé que
rate
chez les
in
femmes.
men was
Parmi les ménages
significantly
arrivés
higher than
avril,
in
le taux de
women.
mortalité
Among the
des femmes
households
équivalent à
who
un décès
arrived
pour 10
since
000
April,
personnes par jour.
1.24
31
deaths.
ont aussi été déclarés disparus dans l'échantillon, ce qui correspondait à un taux de disparition
And then
et de
there were
mortalité de
many people
0,69 pour 10 000 par jour.
that we lost track
La
of,
principale cause de décès rapportés par les répondants
0.9
était la
or
violence,
9%. The main cause
représentant
of death was
56% des
violence, as
décès.
reported by
Parmi
the
les décès
households,
violents pour lesquels
accounting
l'information était disponible,
for
la majorité étaient
56% of the
dus
deaths.
à des tirs par
Among
arme
the
à
data
feu chez des
available,
étudiants. Près de
shooting,
70% des
blasts,
décès violents concernaient
explosion,
des hommes âgés de 15 à
70% of
60
violent
ans.
deaths were with men
Les
aged
décès
15
violents
to
sont
60
survenus
years
le
of
plus
age.
fréquemment sur
Violent
le point de
deaths
départ à
occurred
Zamzam et à El
mainly
Fasher.
on the point of
Et
departure in
plus
Zamzam and Al
proportionnellement en
Fashir.
avril
More than
2025, le
40% of
pic
deaths
en janvier
occurred in
2024
April
ainsi qu'en janvier
24, peak in
2025.
um,
Depuis le début de la
24,
période de
25.
rappel,
He's speaking
9% des
so
membres de
fast.
ménage ont subi
Since
au
the
moins un
recall
épisode de
period,
violence,
9% of
pas
the
forcément violence fatale, dont
households
certains ont été fatals.
were
Parmi les
subjected
personnes
to at
arrivées début
least one
avril, cette
episode of
proportion est de 6%.
violence, and the proportion reached
La
13%
majorité des
among
épisodes
those
ayant lieu sur
arrived
la
since
route
April.
depuis une violence
Most of the
sexuelle
violent
encadrée par
episodes
l'enquête,
happened
malgré
on
des
the road.
informations suggérant le contraire,
We
ce qui
could
indique
we didn't
probablement très
detect
peu
any
d'informations
sexual
sur les décès
violence,
là-dessus.
but I'm sure it was strongly underestimated. We were not able to collect the data on sexual violence.
Similairement, parmi les réfugiés au Tchad,
Similarly,
le
among
nombre
the
de morts nés
refugees
depuis
in
avril
Chad, the
est
crude
estimé à
mortality
1,41
rate
décès pour 10 000
was
passagers par jour. Taux de mortalité
1.41
des moins de 5
deaths
ans
for 10,000
à
people per day.
1,06. La majorité des
Mortality
décès étaient
rate
dus à
in
des actes de
children under
violence
5
survenus
was
principalement en avril
1.06
2025 ou dans les
due
semaines
to acts of
suivantes.
violence
Les
that
violences
occurred
mortelles
in
se sont
April
produites
25
principalement
or the
sur les
following
refugiés à
weeks.
Zamzam et El Fasher,
Lethal violence happened mainly in Zamzam and Al Fasher, the
ou
places
lors du
where the
déplacement initial,
IDPs left from,
tandis que
or
les
during
violences
the
non
initial
mortelles étaient plus
displacement.
réparties entre le déplacement initial et le
Non-deadly
déplacement
violent
ultérieur.
were between the initial move and the moves later on.
En plus des décès dus à la
In
violence, des
addition to
traumatismes
death due to
non
violence,
intentionnels,
non-intentional
diarrhée et
trauma,
malnutrition.
malaria, diarrhea, and
Donc,
malnutrition.
pour les autres causes de décès, les
For
traumatismes
the
non
other
intentionnels,
cause
les
of
polices,
death,
les diarrhées et la malnutrition ont également été
non-intentional
rapportés comme cause de
trauma,
décès.
diarrhea,
Parmi les décès
malaria,
violents, les principales
malnutrition
causes
were
étaient les
reported.
fusillades, les passages à tabac et les
Violent
surnombrages
death,
événements.
shooting,
La mortalité
beating,
touchait de manière
explosion,
disproportionnée
blast,
également les hommes adultes avec un âge
and
médian de
adult
décès de 36
men
ans.
with a median age at the time of death of 35 were
Les
the
éclatements de
most badly
violence,
hit.
dont certains fatals, ont été rapportés
Reported
par
violent
17%
events,
des
some of them
individus, soumis
fatal,
12% à Taouila
were
ainsi que
reported by
17%
17% of the individuals.
majoritairement des adultes.
In
Les
majority
violences ont affecté les
adults,
femmes et les hommes de manière
violence
similaire, mais avec toutefois de
affected
profils
men and
différents
women
selon le
in a
sexe.
similar
Et le plus
fashion,
souvent,
but with
les
different
violences ont
profiles
été
according
commises
to the
par des
gender,
individus en
and most
uniforme.
of very often
Quelques cas de violences
violence were
sexuelles basées sur
committed
le
by
genre ont été
people in
rapportés, mais très
uniform.
probablement largement
Some
sous-estimés.
gender-based and sexual
Ces deux
violence were
enquêtes
reported,
permettent de
but
décrire
they're
la
widely
situation d'une partie des
underestimated.
personnes
Those
ayant
two
fui Zamzam
surveys
lors
allowed
de
us
l'attaque
to
et El
describe the
Fasher par la suite de
situation of
celle-ci,
people who fled
et donner une
Zamzam
image
and Al
précise de
Fasher when the
l'endroit.
city fell.
Les
It
violences
gives you an
subies au
accurate
lieu au
and
départ et
tragic
également lors du
image of the
déplacement,
violence
tandis que les
they were
situations moins
subjected
disciplinaires
to when they
généralement
left and
moins
when they were
évoluées.
on the road.
Ces
The
enquêtes ont récemment fait
situation
pour
at the
documenter les
place of
événements et
arrival
qui ont
were less
témoigné au
concerning,
rythme de nos
apparently.
interventions.
It helped us to do témoignages, but there were
Une partie de la population
limitations. We were
civile
only
ayant
able
réussi à fuir et
to
rejoindre
cover
en
part of the
enquête
population, those
démontre
who
également
managed to
les
flee and
difficultés
that we
à
were able
recueillir
to
dans
meet.
ce type
It shows how
dispositif
difficult it
des
is
informations sensibles,
to collect
en particulier les
sensitive
violences sexuelles.
information, particularly concerning VVS. No,
Un troisième type de
sexual and
méthode
gender-based
repose sur
violence.
les cohortes de personnel
Another type of
utilisées pour plus
method,
facilement redresser les
cohorts of
populations
staff, it's
limitées
used as a
et que le
proxy
contexte
when we have
sécuritaire est
little
stable.
access to the
Elle permet de
population
documenter les
and when
expériences de violence et
insecurity
d'infidélité
is
au sein
high.
des ménages
we can document situations of violence and mortality within the family households of MSF staff. It's not representative of the general population. Juma, who will speak after me, presented a similar survey carried out in Gaza with MSF staff households and neighbors, including cousins, the wider family, to increase the sample size and be closer to the general population, even though it's not a perfectly representative random sample. Fourth method, we use phone surveys or SMS surveys. It's with the general population. Phone surveys can be relevant when the network is working and physical access is limited, although it's very tough to get numbers, to get phone numbers. The private operators are reluctant to give us numbers. We used it in Monrovia during the Ebola and in Cameroon in a conflict zone. In Cameroon, the phone survey and a home survey were carried out in parallel so we could directly compare. The response rate was 43% by phone versus 97 with door-to-door. Comparable results for the CMR, crude mortality rate, but not for the population of displaced people, showing some limitations of the phone approach. SMS survey, we tested this, a very low response rate, though we don't recommend that at all. Not effective. Now, fifth innovative method based on network-based surveys, family media, family social media. We'll do that in 2026 as a pilot project in Sudan to estimate the excess mortality, all causes of death included since the beginning of the conflict in Sudan. We collect information from the respondents and about the respondents and about the death that occurred in their wider family. Population data, scattering of the families. We can infer mortality rates at the scale of the population from what we can gain access to and all the way to states that are not accessible, high potential for coverage, methodological hurdles, though this pilot project will help us to evaluate the feasibility and reliability. We'll do it in parallel to a conventional survey to compare the two. On this slide, you have the main pros and cons associated with each method. All retrospective approaches share common limited, the recall bias, increasing the duration of the recall period. Also, when people are on the road, displaced, they can be separated, so it's more difficult to survey a whole household. Other approaches were explored, but we could find an operational application. Having key informants, it's fast, low cost. We can do real-time monitoring, but it's not as accurate, and it can lead to underreporting. Satellite imagery, we count the number of graves of tombs by satellite. No need for physical access. We can cover large areas with visual evidence, but we cannot identify the characteristics of the people who died and the causes of death. This approach was tested in Zamzam camp, but the results were not very conclusive. This approach, like the others, can be combined by triangulation or capture and recapture. It's promising, but it depends on the availability of multiple sources, which are limited at time of conflict.
There are also prospective methods with community health agents. This will help to have a continuous monitoring of the situation when the context allows for it. Parallel, the analysis of data from our health facilities is essential to document mortality and describe violence, including sexual violence, torture, and trauma due to violence. And this will be discussed in the next presentation by Joma from Gaza. In this presentation, we deliberately focused on quantitative approaches. However, their combination with a qualitative document is absolutely necessary to describe violence in a comprehensive fashion for advocacy purposes, but also to direct medical and operational responses. For 2 years, I've been director. I'm no longer directors. I'd like to thank Erica, Catherine, in particular, because they have helped us to carry out these 2 surveys, as well as Jessica, Emmanuel, Benoit, Hugo, Wendelin, Thomas, and Joma, who will be introduced by Javid right now because they work together.